Thank you all for your patience. Like I said, we were dealing with a technical issue with our ASL interpreters. It happens now and then. And welcome to the Before You Apply session for the HRT Access Fund for the 2025 application period. We're going to do a quick introduction. Unfortunately, Jeff typically leads these meetings. He is out sick today, so you are stuck with me, but Jeff is our executive director. We hope he's recovering and in bed. My name is Tyler, he, him. I am the director of programs with Point of Pride. I've been with the organization as a volunteer since 2017, primarily managing the garment programs. In January of 23, I was onboarded as the first full-time employee. Um, for those of you who have interacted with the programs before, you'll know me as the email guy. I do send out a lot of emails. And before coming to Point of Pride, I worked in the healthcare industry for over 15 years. I do live in Delaware with my preschool or kindergartner and cats, one of which is already circling about my feet, so I'm sure you'll meet her eventually.
And my name's Abby. My pronouns are she, her. I'm the care coordinator, and I've been with Point of Pride for actually a year next month, which is very exciting. My role is to provide support to our recipients to ensure they get the most of their award. And I currently live in Houston, Texas, with my husband, 5 dogs, and 2 cats.
And then just a little bit about our programs. Obviously, you are aware of the HRT Access Fund. That is the program we're meeting about here today. We also have a surgery fund, which provides financial aid to folks seeking assistance for their gender affirming surgery, an electrolysis support fund, providing financial aid toward permanent or semi-permanent hair removal through electrolysis or laser. The Thrive Fund, which covers a variety of other types of care like wigs, prosthetics, voice training, and more. And then the free chest binder and free shapewear program that mail out garments free of charge. If you need any assistance with any of those programs, you can find more information about them on our website. So today's agenda, we're going to go over the program, discuss some important dates, review the applicant experience, the reviews process, the recipient experience, and have an open Q&A. You are also welcome to drop questions into the Q&A module at any time. Abby is going to be monitoring the Q&A. And there's no need to screenshot the program, or the recording will be up on our YouTube channel by the end of the day tomorrow, so that you can have this handy to review. We also see that we've got a few folks here from outside of the US for the international folks. And out of respect for your time and not wanting to waste it, we do want you to know that one of the program requirements is that you are required to be in the United States in order to apply. So if you're planning to move to the US by August 1st, you are eligible to apply. However, if you are not intending to move to the United States, then you would not be eligible for the program at this time. So about the HRT Access Fund, recipients of the program receive 12 full months of membership through their chosen telehealth provider. Or if the provider doesn't offer a membership program, it's 12 full months of covered appointments, coverage of your prescription medications related to your transition and any supplies needed to administer those medications, coverage for lab work and monitoring, and transportation to lab appointments. The program was originally launched in 2020, and to date, we've awarded over $600,000 worth of financial aid. We are expecting between 70 and 90 recipients for this upcoming cycle. Oh, that's my fault. Sorry about that. And we just want to note that access to healthcare is a right that every person deserves. However, unfortunately, like many of our programs, this is a competitive program. We do expect to award between 4 and 10% of everyone that applies. These are the partner providers that we work with for the program. You are able to select any of the partner providers that are available. However, at this time, we do not work with any other telehealth providers, local endocrinologists, or clinics. Links to each of these providers will be included in a follow-up email after this session. And when you apply for the program, we just ask that you verify that you are eligible for the services provided by your chosen telehealth provider. So the requirements for the program, we do require that you identify as trans, and our definition of that is pretty broad. What that means to us is that you identify as any number of non-cis identities, whether that's trans, agender, non-binary, or anything under the umbrella, that you have financial need that prevents you from affording the HRT that you need. You are at least 18 years of age by August 1st, 2025. You live in the United States and you meet all of the eligibility requirements of your chosen telehealth provider. And again, if you are planning to move to the United States by August 1st, you are eligible to apply. When you get to the part of the application process that asks you where you live, you'll just put where you are moving to. So a little bit more about eligibility. You can apply whether or not you've accessed HRT in the past or you're currently on HRT. You can apply regardless of your employment, housing, disability, and or immigration status, regardless of whether or not you have health insurance. And you can apply even if you've already received funding or applied to other HR or Point of Pride programs in the past. The application cycle opened on May 15th, which means the cycle is already open, and will continue to be open until June 30th at 11:59 p.m. Eastern Time. When you apply during that process has no impact, positive or negative, on the likelihood of receiving funding. So it is not a lottery. It is not first come, first serve. We do review the applications thoroughly, and make determinations from there. So again, another reminder for international applicants, you must reside in the United States by August 1st in order to be eligible, and live within the service area of your chosen provider to be eligible. This is partially due to our 501c3 status and partially because the provider's licensing requires you to be in the state in which they are licensed. So if you are planning to move to the US for an extended period of time, like for school or work, you may still be eligible to apply. So a little bit about the applicant experience. This is what to expect on the application form. So you have the opportunity to identify a support person. This person can be a friend, a chosen or blood family member, counselor, social worker, anyone that can help you navigate the application process and submit a high quality application. Support folks are allowed to apply for support in the same cycle. So you can apply for your own aid and also serve as a support person on someone else's award if needed. The support person will be CC'd on any email notifications you get regarding your application status. So you just want to make sure that your support person is someone that you trust with your information, but they are not required, just available should you need additional assistance with the process. Access for your support person can be revoked at any time by emailing us to let us know. The application form is going to ask you for your contact information, some optional demographic information, some information about your HRT needs, and a few short answer responses to demonstrate your financial need and access restrictions. The form is hosted on JotForm, which is a secure HIPAA compliant platform. We store our data following privacy best practices, and more information on that can be found on the privacy policy of our website. So we'll drop a link to the instruction packet in the chat for you in just a moment. And it'll also be included in the email that you receive after the fact. But the instruction packet will walk you through the application form in a little more detail and gives information about the kind of information that we're looking for each response. Specific thorough responses are key. Each short answer can be up to 800 characters, so we do ask that you be as specific as possible. Your application is completely confidential and will only be shared with the reviewers reading your application, and is not intended to be a test of your writing skills. We're just trying to get an idea of what your need is and what's going on in your life, to make sure that we are evaluating your situation correctly. We are looking for authenticity in your responses. So if you're choosing to use something like AI, like a chat GPT or something like that, we do ask that you use it as a tool to edit what you've already written rather than create answers entirely. This is just because chat GPT often creates really generic responses and lacks some of the personal context that helps us get a better idea of the challenges that you're facing. Don't worry about writing perfect answers, but if you find yourself with extra space, consider whether there's more that you can share to give us a fuller picture of your situation. If at any point our reviewers determine that they need additional information, you'll be contacted by email. You may be invited to submit additional written responses or participate in a brief interview to get a better idea of the challenges you're facing. For Florida residents, you will be asked to complete a brief survey about your availability to attend an in-person onboarding appointment with your chosen provider. This is just because state law requires that you have an in-person consent appointment before beginning HRT. If you're selected as a recipient, we will contact you again through email or by phone regarding next steps. The full details of your award will be explained in your recipient agreement. During this process, Abby and I will also host what we call Before You Accept sessions. It'll be a process very similar to this, where we sit down and go through the details of your award with you and make sure that you understand the terms and conditions of accepting your award. And just a few notes about safety and privacy. We will never ask you for sensitive information, like your banking information, account numbers, PINs, or sensitive identity informations, and we'll never request your social security number through email. We will never ask you to send us money. There are some situations in which you may have some responsibility financially for your award, but if that is the case, you'll be required to pay that directly to your care provider and not to us. We do not perform or provide the medical care. We contract, or well, we work with physicians, telehealth providers, and HRT providers to help provide you the services that you're receiving. But we do not perform any of those services ourselves. We just provide the financial support associated with them. And official communication will only come from an @pointofpride.org email address. We will never contact you from Gmail, Yahoo, or on social media for any reason. If you are not selected as a recipient, we will notify you by email as well, and you are welcome to apply again during the next application cycle. We do store your application materials for up to a year, and will continue to pair candidates with financial aid as we are able to, as we receive additional funding or new opportunities. So you may be contacted later in the year to see if you still have need, and if so, connect you with the next steps. So there's a full list of FAQ on our, just a moment. We're switching ASL interpreters real fast. There we go. So there's a full listing of FAQ on our website, but we're going to go over a few of the more common ones here. So what are the age requirements? You must be at least 18 years of age by August 1st, 2025. However, there is no upper threshold for age limit. We have served folks well into their 70s at this point. Um, do we have any health requirements? We do not have any health requirements or limitations for your eligibility. It is your responsibility to meet any requirements that are set forth by your chosen provider. So they may have additional requirements, and you'll want to check with the telehealth provider that you have chosen to go through that. Can we help you pick a provider that is right for you? Unfortunately, no. We cannot provide personalized recommendations. We encourage you to research the telehealth providers that are available and choose one that is right for you. Um, you are ultimately the best judge of who that provider should be. Can the fund reimburse past appointments or medications? No, unfortunately, we cannot. We understand that the challenge that many of us face debt and medical loans in order to afford care. However, the financial aid can only be applied toward future services and will be paid directly to your chosen telehealth provider as the services take place. Can I apply if I am currently enrolled with my chosen provider or if I've used them or another service in the past? Yes, you are still eligible to apply. If you're awarded funding, for current customers, if you're awarded funding, your 12-month grant period will go into effect immediately. Your provider will pause billing for the duration of your grant period and resume it again once the grant period ends. And for past customers, your account will be reactivated and your 12-month grant will go into effect. Your provider may require you to put a credit card on file, but you will not be billed for the duration of your appointment or your award. If I'm awarded funding, how might current laws or political changes affect my access to care? So we are working closely with all of the telehealth providers. We do keep an eye on legislation both at the state and federal levels. And we do make every effort to be proactive and communicative if we are aware of any changes in policy that could affect you, your provider, or your ability to access HRT. So if you're selected as a recipient, we will stay in touch with you to help you navigate any disruption. Unfortunately, it is difficult for us to predict which laws are going to become law or which bills are going to become laws, and ultimately which ones will have effects on you. But we do our best to keep an eye on all of that and make sure that we're helping you navigate the process to the best of our ability. And now we're going to learn a little bit about the reviews process. So during the reviews process, our staff hides identifying information like your name, contact information, and those applications are shuffled into randomized packets of 50 applications for review. So there is no advantage to submitting your application earlier rather than later. They will be mixed up and not put in any particular order. And reviewers will not know when you submitted your application during the process. The packets are distributed to our board of directors, our staff, and the community grant making fellows, who are a group of specially trained volunteers. All CGFs identify as trans and will be reviewing your applications. To minimize the impact of bias, our reviewers follow a scoring rubric and they receive continuing education. And each application is reviewed by at least 3 different reviewers from different lived experiences. So the reviews timeline from the end of the application window, you can expect to wait 8 to 12 weeks to hear more from us. That's about how long it typically to review and select the recipients. And again, 4 to 10% of the applicants will be selected as recipients. So this is a highly competitive process. You will hear from us through email regarding your application status. And we do recommend that you add pointofpride.org to your safe senders list to avoid us being sent to your spam. You can see more information about the program statuses on our website as well. It's going to be pointofpride.org/status. And then we'll go over a little bit of what it looks like to be selected as a recipient. So if you are selected as a recipient, you will receive a grant agreement through your email. This grant agreement will go over the full details of your award, but you will be provided with financial assistance equal to the cost of 12 full months of membership through your chosen telehealth provider or regular appointments with the frequency determined by your provider based on your HRT needs. Prescription medication cost coverage, including some accessory medications and any supplies necessary for administering your HRT supplies like needles, syringes, sharps containers, lab work and monitoring as recommended by your provider, transportation via Uber vouchers to and from your lab appointments, and like we mentioned earlier, transportation to and from your first in-person appointment in Florida for to sign the state required consent forms. We've had a couple of folks ask during the registration process if gel-based HRT is covered. And the answer is yes. The type of HRT is not anything that we restrict. Whatever you and your prescriber determine are the best fit for your needs is what we will cover. We also don't have any limitations on the number of doses you can receive or how much per month. That is something that your provider will determine with you to determine the best regimen for you and your body and your goals. You should expect to cover any travel fees to and from your lab work unless you are using an Uber voucher. Again, Florida residents will be required to sign an in-person consent form. If this is required, we will coordinate with you to see if you need assistance getting to this session. And then New York, New Jersey, and Rhode Island residents, because of differences in state law, your lab visits may not be included in your memberships, but they are eligible for reimbursement through Point of Pride. And if you are not filling your prescriptions through a partner pharmacy where available, you are responsible for paying the copays, but you are eligible to be reimbursed by Point of Pride. So in addition to your recipient agreement, you will receive a couple of other forms in your award packet. A HIPAA disclosure names Tyler, well, myself, and Abby as points of contact that can speak to your provider's office on your behalf. This is to help us with fulfilling payments and also making sure that you're getting your needs met through your provider. A support person disclosure confirms that you're still comfortable with your support person being included on your award materials or gives you the opportunity to remove them if not. Partner authorization form gives us permission to release your contact information to your chosen HRT provider. And a media disclosure, which you see in the screenshot on the right, gives you the options to tell us exactly how you want your name and photos and information to be shared publicly. For your privacy and security, you can be as anonymous as you'd like to be. And we just want to touch a little bit more on those public announcements. We know that is a spot where a lot of folks have questions. Public facing announcements, again, you have complete control over your narrative and whether or not we use your name, photo, or identifying details. Nothing gets published without your permission. We understand that a lot of folks choose to or disclose personal information during their application process to give us a full idea of what they're going through. But those are details that they might not want shared publicly. And we do take a moment to put together a bio and give you the opportunity to review it before we publish it. Our goal is that, we are fostering trans joy. We are allowing you to have the control over the way your experience is shared with the folks that ultimately see your bio. And then again, Abby and I host before you accept information sessions, before you submit your signed paperwork. It'll be a webinar very similar to this, where Abby and I will go over the review or the recipient packet, including those ancillary forms, and answer any questions that you might have about the process from that point. And that is all of the information that we have here. When you leave today's session, you will be given a link to a quick feedback form. We would really appreciate if you could take a moment to fill that out and let us know your thoughts. And then we will move on to the open Q&A. I see Abby's been busy in the Q&A. So someone has asked, as someone living in Florida with limited access to transportation, does the Uber voucher cover going to see the doctor to get the just sorry about that. Does the Uber voucher cover the appointment to get the consent form signed? And are there any costs for that appointment? So the Uber voucher will cover your transportation to and from that appointment, and the appointment is covered under your award. We've got someone asking, will my insurance be notified of the prescription? What if going through my insurance poses a safety risk? So some of the providers have contracts with insurances that if you are insured, whether or not you are able to use that insurance, they must bill your insurance. However, if that is a concern, I would make sure you double check with that provider before you apply, or choose a provider that does not work with insurance to ensure that it's not going through your insurance. We do not require you to use your insurance if you have it. We understand there are a lot of situations in which someone can't safely use their insurance or can't effectively use their insurance because of, coverage exclusions or other uh, plan denials. Someone has asked, do I need to claim the fund on my taxes? So no, because we are paying your provider directly, the money is not considered income for you. It is a transaction between us and your provider. And we do this to avoid impacting your income-derived benefits or your tax status. Someone has asked, I'm willing to see any provider. Can I select more than one option on the form? No, we will require you to select your chosen provider. Your choice of provider will not affect your likelihood of funding in any way. There are not limited spots per provider or anything like that. So just select the provider that is best matched with your needs, and we'll go from there. Okay. Does the fund cover other types of medications? Yes. So in addition to your HRT, Um, the fund will also cover other medications associated with your transition. That would be like the androgen blockers for femme folks. We also do cover some other medications, such as medications associated with like your sexual function, family planning, and supplies associated with injecting your medications if needed. Someone's asked if there's an age limit that's discouraged from starting transitioning. And we are not medical providers. Those are not decisions that we make. The fund covers folks from the age of 18 and up, but those sorts of conversations are best had with someone that is more familiar with you as a patient, and your specific background and needs. Someone has asked if, oh, one moment, just switching ASL real quick. There we are. So someone has asked, would having insurance, even if it doesn't cover your gender affirming care, increase or decrease your chances of being awarded? And the answer is no. It is not something that we consider when we're reviewing the applications. We do ask about your insurance only because some providers, like I said, if you have insurance, they must bill your insurance because of the contracts they hold with those insurers. So we do need to know about your insurance status so that we can keep your provider up to date about those parts of your application, but it does not affect your eligibility or your chances of being awarded. And someone has asked, if I apply, can I gift my award to someone else? And no, we ask that you apply for your own care and your own care only. If you are awarded, but choose not to move forward, there is a process for declining your award, and we will decide who in the application process is next in line to receive those funds. We do not allow you to apply on behalf of another individual or to nominate someone else for services. And someone's asked, what happens if your insurance status or where you live changes after you're awarded? We do ask that you let us and your provider know so that they can make sure that you are still eligible for receiving services through them. However, as long as there's no changes, so as long as those changes don't result in you losing eligibility for your chosen care provider, it will not affect your award in any way. If for any reason those changes do result in you losing access to that particular provider, say you live in a state and you're awarded for a provider, you move to a state where that provider is not available, we will work with you on a case by case basis to determine next steps and whether or not we can transfer your award to another provider. Someone has asked what type of HRT is included in the award. And again, we will leave that decision to you and your healthcare provider about what you think is the best regimen for you and how will best achieve your goals. Do you see the Q&A starting to slow down a little bit? I'm going to leave the session open for a couple more minutes for anybody who might have any last minute questions. But as a reminder, you are welcome to reach out to us through email. If you have any questions that pop up after the session or something that you don't feel comfortable asking right now, you are welcome to reach out through email. We do recommend that if you have any questions, you ask them before you apply. Once your application is in, we do not accept any edits to your application. So once it's submitted, it's in. Someone has asked, if you were in a detention center as a minor, does that count toward the incarceration question? And that's really for you to determine, whether you think that you are someone who has, lived through an incarceration situation. We trust that you are answering that question in a way that feels meaningful for you. All right. Well, like I said, the Q&A has started to slow down a little bit, so we're going to go ahead and close out. Like I said, when you leave this session, you will be sent to a quick feedback form. If you could just provide some thoughts in there, that just helps us make sure that these sessions are meeting folks' needs. We would really appreciate that. And if you have any other questions, feel free to reach us through email. We look forward to receiving your application and, you know, the next steps in our process. Thank you all so much and have a great night.